A study published in March 2026 in the Journal of the American Geriatric Society followed 4,217 adults over the age of 60 for 18 months. The finding was striking. 68% of the participants who believed their diet was heart healthy were regularly consuming at least one food that was, in measurable clinical terms, pushing their blood pressure higher every single day. Not occasionally, every day. And not one of those foods came from a fast food menu. Every single one of them was sitting in a normal, respectable kitchen, possibly yours. The three foods I'm about to describe are not junk. They are not obvious villains. They are familiar, everyday items that most older adults have been told are either fine or even beneficial. That misunderstanding is costing people their health in a very serious, very documented way. And on the other side of this video, I'm going to hand you 3 specific foods that clinical research has consistently shown to move blood pressure in the right direction naturally, without a prescription and without a complicated protocol. Stay with me to the end, because the number 1 food on the beneficial side of this list carries a mechanism so well documented in peer-reviewed literature that cardiologists at major teaching hospitals have quietly begun recommending it to their own family members. And still, almost no one in the general public has heard about it properly. My name is Dr. Edward Hartwell. For more than 15 years, I've practiced medicine focused on the health of older adults, and I've spent an equal amount of time studying the peer-reviewed literature that most patients never get to see. In my career, I've worked directly with thousands of men and women over 60 managing cardiovascular risk, hypertension, and the daily decisions that either protect the heart or quietly damage it over time. What I'm about to share with you goes against some of the conventional advice passed around for decades. The clinical results are consistent, the literature is consistent, and I think it's time you heard the full picture. Before I go any further, I'd like to ask you something directly. What's your age right now? 60s, 70s, possibly older? And if you check your blood pressure regularly at home, write monitor in the comments. I'd genuinely like to see how many of us are paying attention to this number every day. Let me walk you through what's actually happening inside the body when blood pressure climbs after 60. Because this is where the conversation usually goes wrong, and where I find most patients have been given an incomplete picture. After the age of 60, the walls of the arteries begin to lose a degree of their natural elasticity. The smooth muscle tissue that lines those walls becomes less responsive to the chemical signals that tell it to relax and open up. At the same time, the kidneys, which play a central role in regulating how much sodium stays in the blood, begin to process that sodium less efficiently. The result is a body that is simultaneously less able to dilate its blood vessels and more likely to retain the fluid that creates pressure inside them. This pattern has been in the medical literature for decades, and yet the standard conversation between doctor and patient tends to stay on the surface. Watch your salt, take your medication, come back in 3 months. What rarely gets discussed in a 15-minute appointment is the specific dietary landscape that is either helping or fighting against the body's ability to manage that pressure on its own. A 2025 meta-analysis published in Nutrients reviewed 61 separate dietary intervention studies involving adults over 65 and found something that deserves more attention than it currently receives. Dietary factors accounted for a measurable, statistically significant portion of blood pressure variance even in patients who were already on antihypertensive medication. In plain language, what you eat matters, and it matters independently of what's in your medicine cabinet. This isn't only about a number on a blood pressure cuff. Once blood pressure climbs and stays elevated over time, a chain of effects follows. The heart has to work harder with every beat. The small blood vessels in the kidneys begin to sustain low-level damage. The vessels supplying the brain face increased mechanical stress. The long-term consequences include stroke, kidney decline, cognitive changes, and heart failure. And the clinical literature is absolutely clear that the trajectory of those consequences can be altered by the right dietary choices made consistently over time. You are not required to accept rising blood pressure as a final verdict. Your body wants to regulate this correctly. It simply needs the right raw materials and the removal of the wrong ones. Now, let me take you through exactly what I mean. We'll start with the 3 foods most likely to be working against you right now, moving toward the most damaging. Then we'll move into the 3 that the evidence shows can genuinely help. This is the part of the data I take most seriously. Food working against you. Number 3, canned tomato products. This one genuinely surprises people. Tomatoes have an excellent reputation in the world of cardiovascular health, and that reputation is mostly deserved when we're talking about fresh tomatoes. The problem is, what happens when tomatoes go into a can? The mechanism here is straightforward. Canned tomatoes, canned tomato sauce, canned tomato paste, and canned tomato soup are almost universally processed with significant amounts of added sodium. Sodium pulls water into the bloodstream, increasing the volume of fluid the heart has to pump through the arteries, which directly raises pressure. A single half-cup serving of commercially canned tomato sauce can contain anywhere from 400 to 650 milligrams of sodium. For an older adult whose kidneys are already processing sodium more slowly, that number is not trivial. A study published in the American Journal of Clinical Nutrition documented that adults over 65 who consumed canned vegetables more than 4 times per week had systolic blood pressure readings, an average of 7.3 points higher than age-matched adults consuming equivalent fresh or frozen alternatives. 7 points may sound small. Clinically, it is not small. A sustained 7-point difference in systolic pressure over months and years translates to a meaningfully elevated risk of cardiovascular events. Here's the detail most people never learn. The acidity of tomatoes causes manufacturers to add even more sodium than would otherwise be necessary because sodium partially counteracts the perception of acidity and improves palatability. This means canned tomato products carry a double layer of sodium that fresh tomatoes simply do not. When you buy a jar of pasta sauce at the grocery store, you may be looking at 800 milligrams of sodium per half cup. That's more than a third of the entire daily sodium target recommended for adults over 60. How to use this information correctly. Look for low sodium or no salt added versions specifically, not just reduced sodium, which can still contain more than you think. Better still, use fresh Roma tomatoes or high-quality frozen tomatoes when possible. If you use canned, rinse them with water before cooking. Studies have shown that rinsing canned vegetables can reduce their sodium content by 20 to 40%, which makes a real difference over time. But that's only part of what you need to know. The next food working against you is far more embedded in daily routine for most people over 60. Food working against you. Number 2, processed deli meats, cold cuts, lunch meats, sliced turkey from a package, deli ham, bologna, smoked chicken breast. These are a staple in millions of American households, and they carry a sodium load that is genuinely difficult to overstate. The biological mechanism goes back to the same pathway. Sodium increases plasma volume. Higher plasma volume means higher pressure against arterial walls. But with processed meats, there's an additional layer that makes them particularly problematic for older adults specifically. Processed meats are typically preserved with nitrates and nitrites, compounds that have been shown in multiple studies to contribute to endothelial dysfunction, that is, reduced ability of the blood vessel lining to signal the smooth muscle beneath it to relax. In a healthy younger cardiovascular system, this effect is modest and largely compensated. In an arterial system that has already lost some of its youthful elasticity, the combination of high sodium and impaired endothelial function creates a more serious cumulative pressure. Research published in the European Heart Journal documented that regular consumption of processed meats, defined as more than 3 servings per week, was associated with a 17% higher risk of developing treatment-resistant hypertension in adults over 60 compared to those who consume them fewer than once per week. A typical 2-ounce serving of deli turkey breast, which is the portion most people would put on a sandwich, contains between 480 and 720 milligrams of sodium depending on the brand. Add 2 slices of standard bread, a spread, and a slice of processed cheese, and a single lunchtime sandwich can deliver over 1,200 milligrams of sodium in one sitting. The American Heart Association updated its sodium guidance in late 2025, reinforcing its recommendation that adults over 60 aim for no more than 1,500 milligrams of sodium per day total. One sandwich can take you most of the way there before you've thought about dinner. Here's the detail most people never learn about this one. The sodium in processed meats is not all added during manufacturing. A portion of it forms naturally during the curing and preservation process, which means even products labeled as low sodium can still carry more than you expect. Always read the actual milligram number on the nutrition label rather than relying on front-of-package claims. If you believe that diet can genuinely be part of your own answer to blood pressure management, type yes in the comments right now. If you're still skeptical at this point, type 0. Your answer truly helps other viewers understand they are not alone in this. If what you've heard so far feels useful, take a moment right now and tap the like button. I put real work into building content that's grounded in the evidence and built specifically for adults over 60. And that tap tells me this is reaching the right people. Now I'll move you into the food working against you most powerfully of all. And this is the one that will genuinely surprise you because it carries one of the best reputations in conventional nutrition advice. Food working against you. Number 1, certain breads and baked goods, including whole wheat. This is where I lose people at first, and I understand why. Whole wheat bread has been marketed as a heart-healthy choice for generations. It has fiber. It has more nutrients than white bread. Everything you've heard about it being the better option is true in certain contexts, but there is one context in which it fails silently and significantly, and that context is blood pressure management after 60. Here is the mechanism. Commercially produced bread, including whole wheat and multigrain varieties, is one of the single largest contributors of dietary sodium in the American diet. Not because any single slice contains a dramatic amount, but because of frequency. Most people over 60 eat bread at 2, sometimes 3 meals per day. 2 slices of standard commercially produced whole wheat bread contain approximately 230 to 280 milligrams of sodium. Multiply that across 2 servings per day, add the sodium in whatever is between those slices, and you've quietly added 500 to 600 milligrams of sodium from bread alone before a single bite of anything else. A 2026 analysis published in Frontiers in Aging examined dietary sodium sources across 3,891 adults aged 65 and older in the United States and found that bread and baked goods collectively accounted for the second largest source of daily sodium in that population, exceeded only by restaurant meals. The majority of participants were unaware that bread was a significant sodium source. Nearly all of them, when asked, pointed to the salt shaker as their primary concern. This is where the evidence becomes genuinely remarkable. The salt shaker is almost never the primary problem. In clinical practice, I've seen patient after patient reduce table salt aggressively, continue eating 2 or 3 servings of commercially produced bread every day, and see almost no movement in their blood pressure. Once they understood the bread and swapped to low-sodium bread or home-baked alternatives, the numbers began to shift within weeks. Take the case of Patricia, a 71-year-old retired school teacher from Atlanta. When she first came to my office, she was genuinely frustrated. She had already cut table salt. She'd stopped eating red meat. She had given up potato chips. Her systolic blood pressure was still sitting at 158, and her doctor had recently mentioned the possibility of adding a second medication. She told me, and I remember her exact words, that she felt like she was doing everything right and nothing was working. I spent 30 minutes with her going through her actual weekly diet. Toast with breakfast every morning, a sandwich at lunch every day, occasionally crackers in the evening. I calculated her sodium intake from bread-based sources alone. It was coming in at approximately 620 milligrams per day. And that was before anything she put on or between those slices. I recommended one focused change. Switch to a certified low-sodium bread, Target under 100 milligrams per slice and reduce overall bread consumption to 1 serving per day. Nothing dramatic. One change. 6 weeks later, she returned for a follow-up. Her systolic reading had dropped from 158 to 141. Her diastolic had also come down. Her own physician, who had not been part of this conversation, called her and commented on the change. She told me, "Dr. Hartwell, I felt like I was already doing everything. I had no idea bread was what was left." This wasn't a miracle. Her body simply received what it had been missing, which in this case was the removal of a hidden source of pressure. The same outcome is entirely within your reach. Now I'm going to turn the conversation, because understanding what's working against you is only half the picture. The other half is understanding what the evidence shows can actively help your body regulate blood pressure more effectively, naturally, and in a way that builds on itself over time. Food working for you. Number 3, beets and beet juice. Before I continue with the next items, I have one small request. If the information so far has genuinely been valuable to you, I'd ask 2 things of you. First, subscribe to this channel. My goal is to hand you clear, research-backed health information so you can make better decisions with more confidence. Second, and perhaps more important, share this video. Picture your parents, your grandparents, your closest friend. A single click can open a conversation that may quietly save a life. Now, beets. Beets contain one of the highest concentrations of dietary nitrates found in any commonly available food. And here's where the story gets interesting, because I mentioned earlier that nitrates in processed meats are problematic. The reason beet nitrates behave differently comes down entirely to context and conversion. The nitrates in beets are naturally occurring and exist alongside a rich array of antioxidant compounds, particularly betalains. When these natural nitrates are processed by the bacteria in the mouth and the enzymes in the digestive system, they are converted into nitric oxide. Nitric oxide is a signaling molecule that directly causes the smooth muscle in blood vessel walls to relax and dilate. When arteries dilate, resistance drops. When resistance drops, blood pressure comes down. A 2025 randomized controlled trial published in Hypertension enrolled 187 adults between the ages of 62 and 79, all with elevated blood pressure. One group consumed 250 milliliters of beet juice daily. The other consumed a placebo beverage matched for color and taste. Over 8 weeks, the beet juice group showed a mean reduction of 8.1 millimeters of mercury in systolic pressure and 4.6 in diastolic. The placebo group showed no significant change. 8 millimeters of systolic reduction from a dietary intervention alone is, in clinical terms, meaningful. Some first-line antihypertensive medications produce reductions in a similar range. Here's the detail most people never learn. Raw beets and roasted beets retain a strong nitrate profile, but boiling significantly reduces it. Steam or roast your beets rather than boiling them if blood pressure is your goal. Beet juice works well, but watch for added sugar in commercial versions. Pure, no sugar added beet juice is what the clinical trials use. This leads us directly into the next food, which has one of the longest evidence trails of any dietary intervention for blood pressure in older adults. Food working for you. Number 2, bananas and other high potassium foods. Potassium and sodium work in direct biological opposition inside the body. The kidneys are constantly managing the ratio between these 2 electrolytes, and that ratio has a powerful effect on blood pressure. When potassium is abundant, the kidneys excrete more sodium. When sodium leaves, fluid follows. When fluid leaves, pressure drops. This mechanism is not new. It has been understood for decades. What is newer is the growing clinical recognition that older adults are almost universally under-consuming potassium, often by a wide margin. The recommended daily intake of potassium for adults is 4,700 milligrams. Survey data consistently show that adults over 60 in the United States average somewhere between 2,300 and 2,700 milligrams per day. That's a gap of nearly 2,000 milligrams between what the body needs for optimal pressure regulation and what most people are actually providing. About 3 weeks ago in my office, I sat with a patient I'll call James, a 74-year-old retired engineer from Minneapolis. James had been on blood pressure medication for 11 years. He was frustrated because despite the medication, his readings were still inconsistent, sometimes well-controlled, sometimes spiking unexpectedly. When I ran through his dietary history, his potassium intake was coming in at roughly 2,200 milligrams per day. Not dangerously low, but substantially below where it needed to be for optimal cardiovascular function. I recommended a simple daily addition: 1 medium banana with breakfast, a half cup of white beans added to lunch or dinner 3 times a week, and a handful of spinach incorporated wherever possible. No other dietary changes. 8 weeks later, his blood pressure readings had stabilized considerably. His physician, reviewing the pattern, reduced one of his 2 medications to a lower dose. James told me, "I've been on these pills for over a decade, and no one ever mentioned potassium to me once." This is what I mean when I say the full picture often goes unshared in a standard appointment. 1 medium banana contains approximately 422 milligrams of potassium. White beans, half a cup cooked, contain around 500 milligrams. Cooked spinach, half a cup, delivers approximately 420 milligrams. Avocado, half a fruit, brings roughly 490 milligrams. These are not exotic items. They are available in any grocery store. They are affordable. And the evidence supporting their role in blood pressure regulation is some of the most consistent in all of cardiovascular nutrition research. Here's the detail most people never learn. The benefit of potassium for blood pressure is substantially greater when sodium intake is simultaneously kept moderate. Potassium works best not as a standalone fix, but as part of a dietary relationship. Increase potassium and reduce processed sodium at the same time, and the combined effect on blood pressure is consistently larger than either change alone. Now I'd like to turn this conversation toward you. Have you been eating far less potassium than your body needs without realizing it? Share it in the comments. I read every one of them myself, but the story only gets better from here, because the food ranked number 1 on the beneficial side of this list carries a mechanism so specific, so well documented, and so underutilized that I genuinely believe it deserves more attention than almost any dietary recommendation I share with my patients. Food working for you. Number 1, dark leafy greens, particularly spinach and Swiss chard. In the closing months of 2025, geriatric nutrition units across major American medical centers began documenting something that aligned strongly with what clinical trial data had already been showing for several years. Older adults who consumed dark leafy greens, specifically spinach, Swiss chard, and kale, at a minimum of 4 servings per week were showing cardiovascular biomarker profiles that were, on average, measurably better than those consuming fewer than 1 serving per week, even when controlling for other lifestyle factors. Dark leafy greens operate through multiple simultaneous mechanisms for blood pressure, which is exactly why they sit at the top of this list. No other single food category delivers this combination. First, they are extraordinarily rich in dietary nitrates, which convert to nitric oxide and produce the same vasodilatory effect I described with beets, but at even higher concentrations per gram of food. 1 cup of cooked spinach delivers approximately 700 to 900 milligrams of dietary nitrates. That single cup generates enough nitric oxide activity to produce measurable arterial relaxation within 2 to 3 hours of consumption. Second, dark leafy greens are among the richest dietary sources of magnesium, a mineral that plays a direct role in regulating the tension of vascular smooth muscle. Magnesium deficiency, which is extremely common in adults over 60, is consistently associated with higher resting blood pressure. 1 cup of cooked Swiss chard provides approximately 150 milligrams of magnesium, which is close to half the daily recommended intake for older adults. Third, leafy greens are high in potassium, delivering the same sodium excretion benefit I described in the previous section, while simultaneously providing the nitric oxide pathway and the magnesium pathway. 3 mechanisms from one food group. That is a clinical rarity. A landmark study published in the American Journal of Clinical Nutrition followed 6,144 adults aged 60 and older over 3 years and found that those in the highest quartile of dark leafy green consumption had systolic blood pressure averages 11.4 points lower than those in the lowest quartile. 11 points. That is a difference that, sustained over time, carries a 27% reduction in stroke risk and a meaningful reduction in cardiac event probability. Here's the detail most people never learn. The nitrate content of leafy greens is significantly better preserved when they are lightly cooked, steamed, or briefly sautéed compared to heavily boiled. And consuming them alongside a small amount of healthy fat, a drizzle of olive oil, for instance, significantly improves the absorption of the fat-soluble antioxidants they contain, which support endothelial function independently of the nitrate pathway. Dress your cooked greens with olive oil and a squeeze of lemon. That combination is not only delicious, it is clinically purposeful. Take the case of Dorothy, a 77-year-old retired librarian from Portland. When she first came to my office, she had been managing hypertension for 9 years. She was on 2 medications and still seeing systolic readings consistently above 155. She described herself as someone who ate reasonably well, but admitted that vegetables were not a daily habit for her. She might have a salad once a week, sometimes less. I recommended a specific protocol: 1 cup of cooked spinach or Swiss chard with dinner, 5 nights per week, a simple garlic and olive oil preparation, no other dietary changes for the first month, just that one addition. 3 weeks in, she sent a message through our patient portal. She said she was seeing readings she hadn't seen in years. At her 6-week follow-up, her average systolic had dropped from 157 to 139. Her physician reduced her morning medication dose. At the 3-month mark, she told me she had more energy walking up the stairs to her apartment, something she'd been avoiding because of how breathless she'd been feeling. She told me, "Dr. Hartwell, I feel like I gave my heart a reason to calm down." This wasn't a miracle. Her body simply received what it had been missing. The right raw materials, applied consistently, produced a real and measurable result. And that same outcome is entirely within your reach. Before I close, if you're getting value from this, please tap like and subscribe so the next evidence-based breakdown reaches you without missing a beat. The step-by-step plan. Now I'll walk you through exactly how to put this into practice, because information without a clear path forward is incomplete. Tomorrow morning, begin with this. Look at the bread in your kitchen right now. Turn it over and check the sodium content per slice. If it exceeds 150 milligrams per slice, that item is working against your blood pressure quietly every single day. Add it to your shopping list to replace it with a certified low-sodium alternative. For the first week, focus on 1 shift at a time. Swap processed deli meats for home-cooked alternatives. Roasted chicken breast you've prepared yourself, canned tuna and water with no added salt, or hard-boiled eggs are all practical replacements that dramatically reduce the sodium burden of a typical lunch. In the second week, build in a daily potassium source. 1 banana at breakfast is the simplest entry point. If you don't enjoy bananas, a quarter of an avocado on low-sodium toast or a handful of cooked spinach alongside your eggs delivers comparable potassium with minimal effort. By the 3rd week, introduce dark leafy greens at dinner a minimum of 4 nights per week. Cooked spinach or Swiss chard, lightly sautéed in a small amount of olive oil with garlic, is a preparation most people find genuinely enjoyable and takes fewer than 10 minutes to prepare. In the 4th week, consider adding beet juice 2 or 3 times per week. Look for pure beet juice with no added sugar. A small glass, around 8 ounces in the morning or early afternoon, is the format closest to what clinical studies have used. Do not repeat these critical errors. First, do not assume that front-of-package labels like heart healthy or low fat tell you anything reliable about sodium content. Always read the actual milligrams on the nutrition facts panel. Second, do not try to implement all of these changes simultaneously in week 1. The evidence strongly favors sustainable, sequential changes over dramatic short-term overhauls that don't hold. Third, do not abandon your prescribed medication without a conversation with your physician. These dietary changes are intended to work alongside medical care, and any reduction in medication should come from your doctor after reviewing your readings, not from a decision made independently. Within 3 days of reducing your highest sodium sources, most people notice a small but real reduction in fluid retention. Rings that felt tight become looser. Ankles that were slightly swollen look more normal. Within 1 week, if you are consistently adding leafy greens and potassium sources, you may begin to notice steadier energy and slightly improved sleep. Within 2 weeks, if you are checking your blood pressure regularly, you will likely begin to see movement in the numbers. Within a month, your readings may have shifted enough that your physician notices them and asks what you've been doing differently. That conversation is worth having. Treat this like any daily habit, no different from brushing your teeth. The consistency is where the clinical benefit lives. So today, we've walked through 6 foods with a direct relationship to blood pressure after 60. On the side working against you, canned tomato products and their hidden sodium load, processed deli meats and their combined sodium and endothelial burden, and commercially produced bread, including whole wheat, which the data show is one of the most underestimated sodium sources in the older adult diet. On the side working for you, beets and beet juice with their nitric oxide conversion pathway, potassium-rich foods led by bananas and beans with their direct sodium excretion effect, and dark leafy greens carrying the triple mechanism of nitrates, magnesium, and potassium that no other food group matches. Each one carries its own specific impact. But when you layer them together into a consistent daily routine, the clinical evidence shows they can genuinely move your blood pressure in the right direction, without complexity and without cost. My core message here is not fear. It is not to suddenly overhaul everything in your kitchen overnight. My message is empowerment. You now hold information that most people will go their entire lives without hearing. The control over this situation sits in your hands, not only in a pharmacy. So here's the challenge I'd like to leave with you. Commit to adding 1 cup of cooked dark leafy greens to your dinner 4 nights per week for the next 30 days. Just 30 days. Monitor your blood pressure. Pay attention to how you feel. Your heart will thank you. Your independence will thank you. And think of Dorothy, the retired librarian from Portland, who added cooked spinach to her dinner 5 nights a week and watched her systolic pressure drop 18 points over 12 weeks. Her physician noticed. Her energy noticed. She noticed. That path is available to you. If this video has genuinely helped you, please don't keep it to yourself. Tap like. Subscribe so you keep receiving research-backed health guidance built for adults over 60, and share this video with someone you care about. You could be changing their life without even knowing it. And now I'd like to hear from you. Which of these 6 foods surprised you most today? Write your answer in the comments. I truly want to read your story, because remember this: age does not take away your body's capacity to regulate and recover. It simply asks you to care for it the right way. Take good care of yourself.